Aloha, I'm Dr. Scott Sanderson. I am here at Elite Health Hawaii in downtown Honolulu with Rick, one of my patients here. He has come to us and he does some of our HRT program, and I just wanted to bring him on camera today to have him kind of explain what it's like and sort of some of the things that people can expect, because I tell people some of the benefits of the program all the time, but you know, that's always coming from me. And it's maybe not as real as it could be if you actually hear it from a real patient. And so I just want Rick to kind of talk about a little bit about his experience, okay? So now, let's start. How old are you, Rick?
I'm 73 years old,
73.
and I'm a licensed general contractor, and I still go to work every day.
Yeah.
And I wear my nail bags, and on Monday we
And you're not just directing?
No,
no.
we poured and finished concrete on Monday, started framing on Tuesday, and more demo and more framing on Wednesday, and we're going full on.
All right. Now, what would that have been like to try to do that stuff before you started?
I wouldn't have taken the job.
Oh, okay.
I was just doing real simple, easy handyman stuff, taking care of a big house, little things that I could get around. Before, it's like I'd get up in the morning and I'd get out of bed and I go, oh, no, my feet are so sore and my knees hurt, I can't hardly walk. And then it's like the first thing you do is you have to go find an Aleve so you can feel better and go to work.
Yeah, testosterone has that effect on people where it just really helps to decrease inflammation in the body. So I see a lot of people with decreasing inflammation and a lot less aching. They recover more quickly. So you're not taking the Advil or the Motrin or anything anymore?
I haven't taken it for probably 2 months.
That's awesome.
It just got to the point where I don't need it anymore, and it has totally made all the pain from gone. So what do you call that? The joint pains and arthritis. Yeah. It just seems to have gone away.
Now, did you feel after a day of work before you started replacement
I
therapy?
was really tired.
Yeah.
And I'd have to come home and start drinking some beers and a bottle of wine just to feel normal. Now it's cut down. It's just like I come home, I have a beer when I get home, and then we just have a glass of wine. And so because of that, and then you talked to me about the diet and different things like that. And so since we changed the diet, I lost 9 pounds and didn't even try. It just went poof.
Yeah.
And
that's a big thing with, especially, a little diet modification prior to this, might have got you some results, but nothing like once you actually fix your hormones, then you can truly actually burn fat, as opposed to, like, I was the same way. Before I fixed my hormones, got everything corrected, I was doing triathlons, but I was that round runner. I was that guy who had, you see him cruising down the street and you're like, looks like I see that guy running all the time, but he's really round. That was me. Yes. So I had a real hard time losing weight, but once I fixed my hormones, it really came off a lot easier that way. Now, what about, how are you feeling as far as strength is concerned?
I would say that I am stronger, and I kind of gave up on losing weight anymore. I feel really good, and I kind of gave up on feeling stronger, but it's all about, I want to look good. So, I want to have the upper body arm look, and the chest, and then the cut, six pack, and so that's what I'm working on. And because of your help, it's really working.
Awesome.
And I get up, and now I feel like instead of talking about going and doing something, we get up and go and do it, because I have the extra energy to do it.
Because you just went on a really big sailing trip, didn't you?
Yeah, for my birthday we sailed around the island.
Around the whole island?
Around the whole island.
Awesome.
It took 10 days. We stopped in Kaneohe for 6 days, sailed to Waimea, stayed there, and then sailed over to Makua, and then Pokai Bay.
Right.
That's a lot of hard work.
Yeah.
Especially 3 days in a row of sailing.
How'd you feel doing it?
I felt great.
Good. Nice and easy for you, huh? Yeah. His wife PJ was telling me a little bit about how she said your energy levels were just great the whole time.
They're really
He
good.
was killing it.
Yep.
Yes. So speaking of PJ, his wife is here off camera. How is your relationship? As the improved energy, things like that, has that helped?
Excellent.
Awesome.
Yep.
That's all we need to know.
Okay, I won't go into any details.
No, we don't need to do that. We'll just leave it. Excellent. That's what she's giving the thumbs up. That's all we need.
And she makes my lunch every day, and we don't go out to eat.
Excellent.
And so we're real conscious of what we eat and trying to have good food so that we're healthy and keep our immune systems high.
That's excellent. Because really what it comes down to is you're doing these things, and then with the testosterone replacement, and so we have your hormones on point, and now you're doing the good things with your diet, and you're obviously very active and getting some good exercise too. And we put it all together, and what it adds up to is this system that allows you to continue to live with a really high quality of life for as long as you want, basically, to continue to live life on your own terms. I don't know many 70-something-year-old people who could go out and do what you do in the first place, but especially not at the level you do it now. And now you're just taking it to the next level. So I mean, you're gonna be doing this when you're 80, no problem.
Sounds good to me. I just want to keep on going.
You know, I think people have a lot different idea of aging now, right? And
You do.
want to stay active. You know, people don't think of, well, you're obviously not retired,
Nope.
but
Don't plan on it.
people want to work longer, and we can give them that ability.
And I have a really good feeling of well-being.
That's excellent.
So I feel very comfortable with myself and calm and no stress.
Yeah.
I don't feel
Do you
any
feel like
stress.
you handle stress better now?
I always handled stress really well, but I would say it's even better now.
Yeah. I hear that from a lot of men, actually. It's an interesting effect with the testosterone, is that a lot of guys will say something that used to bother them in the past or would maybe cause them some anxiety. They'll look at the same thing and say, yeah, I see that, but I got that. It's kind of confidence level. Maybe they're just like, yeah, sure.
I think that's probably it increases your confidence level.
Yeah. Yeah,
And
absolutely.
you feel like you can try harder and do more things.
Yeah. Yeah, and now, so how's your mood overall? Because
Yeah, it's good.
Good. Yeah, a lot of spouses will ask me, and they're worried about, oh, if he's on testosterone, is it going to make you irritable? It's like, no, it's usually the opposite. Because men who have low levels oftentimes are irritable because they feel like junk all the time. So they feel tired all the time. A guy feels run down, he's going to be snappy and irritable.
I would say so.
Generally, myself, I know for sure, once I got things fixed, that I just feel better at home. I feel better at work. So when you feel better, you're happier.
You're happier. Yeah. Feel confident, happier, and you want to go and do things. We used to talk about, Saturday morning, let's go sailing. And I go, oh man, I don't know. I'm too tired. I'd love to go sailing, but I don't think I'm going to make it. And now as we get up Saturday morning, it's, yeah, let's go sailing.
Excellent. That's really that's what it's about. It's about that quality of life. I think in medicine, we've kind of lost sight of quality of life. We're still emphasizing, saving lives, which is great. And we've gotten really good at that. But we lost sight of improving the quality of life. And that's what this program is really all about, is maintaining a high quality of life so that you can live life on your own terms and
Yep.
feel good while you're doing it. Yes.
I feel good. It's really helped.
So would you recommend this?
Absolutely recommend it. Yeah, I've already told
Or you want to keep it your secret?
other people about it, and they're interested.
Yes. Yep. I've had a few calls.
Good.
Thank you. I appreciate that.
Yep.
I think that's the highest compliment you can ever get. I have a lot of referrals from other patients, and that I love that because it lets me know that I'm doing things right for my patients. And, from my perspective, that makes this like, I feel like I'm a coach that's on a team that's just always winning.
Yeah.
And it's like, it's much fun.
That's what we want to be as winners.
Yes. Yes.